God, Dakwadoa, Cherokee Watts. Hello, everyone. This is Cherokee Watts with Cherokee411. And we're here today with one of our incredible employees of the Claremore Indian Hospital. Her name is Kathryn Martin. She lives here locally in Rogers County, which is where the Claremore Indian Hospital sits in Claremore, Oklahoma, in Rogers County, which is part of the Cherokee Nation. So, Kathryn, would you prefer Kathryn or Katie?
I usually go by Katie, but I
Okay,
am
well,
open.
we're going to call you Katie because that's what you prefer. So, Katie, is so nice to meet you. I appreciate you reaching out to tell your story because it's really going to tell a lot of our staff's story, the team that makes our world better at Claremore Indian Hospital. So, tell us who you are as an Indian person, or who you are just if you're not Indian, who you serve, why you're at Claremore Indian Hospital.
So I actually am not a tribal member.
Okay.
I was able to get a treasured position on this team by being a veteran. So I have spent my entire career in a public servant capacity. 6.5 years of that as military service. I worked 12 years of labor and delivery bedside in a high risk OB setting. And then now I have had nearly 5 years of experience as a certified nurse midwife.
That's incredible. Thank you for your military service, Wado. Thank you for your service to us, especially our women, our families, the kids here at Claremore Indian Hospital. So, just to clarify, because I think what's getting lost in our lovely tribal politics is so you don't have a dog in the fight, so to speak, because you're not a Cherokee person, but you have a dog in the fight because this is a facility you serve and a community you serve. But
Absolutely.
but
And a
not the
community that
typical.
I'm passionate about serving.
Thank you for that too. And you moved your family here to Rogers County, is that correct, to finish serving your career?
We did. So I actually completed my midwifery training at Hastings. And after I graduated, I took a position there and worked there for 3 years before coming to Claremore. Um, and I actually transitioned to Claremore because it's closer to my home. And I love the concept of being a part of an established midwifery group, serving its community in such a committed way. The centering for prenatal visits that we offered that really brought families together and really gave us a chance as providers to facilitate more of a relationship between us as well as among patients, so they build that community and network and don't feel so alone in their postpartum time.
The comments that have come across social media from the women and families that you guys have served as a team really is reflective. Like, so when I spent 12 years on tribal council, we would go to DC and we would lobby and we would fight for the right to make sure that our healthcare reflected us culturally. And it sounds like even though you come from a different background, you're not Cherokee, but you've committed to help serve us in that way as Indian people to create the environment that as Indian women we need when we're birthing kids, right? That's what I'm hearing.
Absolutely. To
Okay.
rebuild some of the trust that has been so broken for all of these years and to correct and hopefully build up these women so that they can grow back in their culture. Like, our whole purpose is to honor the culture. And that is our purpose as midwives in general. Um, if you want to say that improving maternal health care is your priority, then your practice should reflect that. And it does where we are.
And that's the current Claremore IHS team. And I think someone sent me data that I'll share on Cherokee411 that proves that Claremore IHS has done an exceptional job with delivery of babies, the postpartum issues, because there's so much more than just delivering a child. It's the
Right.
before and after as
You
well, what I
can look
hear.
at it as they only have averaging one delivery a day, but you can't just look at the numbers because the care that we give can't be defined in numbers only. We do not do elective inductions until 41 weeks, meaning we allow adequate time for labor to start on its own, unless there's a medical reason. And if somebody is choosing to do that, of course, there's a risk and benefit discussion beforehand. And sometimes there are elective inductions for necessary reasons that aren't quite medically indicated. But it is an individual discussion and not a broad blanket.
Yeah, that's helpful. So um, I'm concerned that our employee stories aren't being told. So I was really excited when you said you would come on with me to share this. So communication is always a struggle. I don't care what the organization is, I don't care what's going on. And even though into 2025, we have more opportunities to communicate, it's almost made communication worse. Yes, I know, it's amazing, right? So I think the first initial announcement was September of 2024 that the Cherokee Nation was going to take over Claremore Indian Hospital.
Yes.
And
And it was
Katie,
made to seem a celebration.
yes, and well, and so I'm going to insert myself just a little bit. So I served, I think, 10 years as the chair of the Tribal Advisory Board for Claremore Indian Hospital as a representative for Cherokee Nation when I was on tribal council. And I took pride in that for many reasons. But one of the things that was critical about that role was the intertribal relationships with the other tribes that Claremore Indian Hospital served. And when I reached out to other tribal leaders, they were completely blindsided by the takeover call from the Cherokee Nation in September. I think there were rumors at the Indian Hospital, but I don't know that anything had been communicated to the staff at that point. It was just announced publicly, acted like the party was already happening. That was my take. Is that reflective of what you guys felt as employees, the team at Claremore Indian Hospital?
Yes. So there were rumors and everybody was worried. And they said, don't worry, it's not happening. And everybody kind of relaxed. And then the official word came down. And then it was like a celebratory affair. And we were told that we were going to be given so much information and nobody needed to worry about having a position because their goal was to expand services and not decrease. Um, and that is important, especially for us as certified nurse midwives in a laborist position, because our state inherently is not midwifery friendly. IHS and tribal facilities are the major employer of certified nurse midwives in our country. They are not well integrated in many other facilities, though there is quite a lot of growing interest in it because our statistics speak for themselves. We improve care, we improve perception of care. And so that we didn't hear anything. We were told that we would have meetings to discuss 6 months out because they had to give us 6 months of notice at least to make plans. And that would have been April. And April came and went, and they said June. And then we didn't hear anything until we were told that we are not going to have a position. And that's also important because it takes time as a provider to credential in a new job, much less acquire, like interview and find a new position. So that would require me potentially to move out of state to make an equivalent or comparable position for my family.
So, Katie, you didn't hear anything else until this Monday, 2 days
No,
ago, then.
no. And if it's an outpatient only facility, there is no reason to have a team of 4 midwives and a family practice doc. and especially if their plan is not to have an OB clinic and they're going to outsource those services. But is that really a better provision of care?
I will tell you the feedback I've gotten from, well, my feedback as a patient, my family's feedback as patients, and then all the people around me, they do not want to drive to Tahlequah for care. And that's the only option. I was alarmed when their reframing of the issue or their response was, well, you're going to get a shiny new building in 2 years. Well, we lose important staff like you that are trained, and it's still only an outpatient and standalone ER. It's not the hospital that
And
we
people don't
know we need.
understand that a standalone ER, while they have stabilizing capability, if you have a serious issue that needs immediate intervention, you are wasting time at a standalone ER.
Yep. And that discussion's not even being had. I was alarmed when the Channel 6 news coverage that I just listened to this morning, because I was traveling yesterday. I took a personal day and I was like, how does this happen on my one day I take off? And I'm like, they just gloss over. And it's like, well, we are all getting a new building. And I'm like, that doesn't matter if we don't have providers and services and surgery and ability to deliver babies and all those
Or
things.
this idea that patients can just go acquire insurance or care elsewhere. If you go into that building and you look around at the patient population that we serve, many of these people can barely afford to get in to see us. And that
Yeah.
is a huge barrier to then expect them to go to traditional healthcare practices where they maybe haven't had a great experience. They're
Yeah.
not getting culturally sensitive care, or they have to drive all the way to Tahlequah or to Tulsa to get care that we had already been offering.
Yep. I mean, gas money, tires. I mean, some people just don't have vehicles that can travel that far. They have to arrange for other things. Yep. So by the way, I can't say enough on behalf of all of our women and families about the OBGYN facilities and the team that serve us at Claremore Indian Hospital. Thank you for that. Katie, I've taken up too much of your time, I feel like, because you guys are valuable. But is there anything else that you want to share with our listeners about what's happening at Claremore Indian Hospital and the Cherokee Nations?
I would just like to say, ask for the numbers, compare our statistics. We do good work, and I don't want anybody to have any mistrust or fear from the words that have been said about the care that has been provided there, because I can tell you that we are all committed to you having the experience that you want, that is respectful of your dignity and your desires.
That's incredible. And that's what my experience is. That's the experience of my family and friends. So thank you on behalf of the Cherokee Nation citizens and the other people that love all of you at the Claremore Indian Hospital and are really disturbed about the decisions being made without their input. So our prayers are with you and your family. And if there's anything we can do to help you find a home, a health home that appreciates you, please let us know. Okay.
Thank you so much.
Thank you to all of our listeners. Please tune in for the next. We want to hear from you about what you think about the Cherokee Nation's takeover of the Claremore Indian Hospital. And Wadeau, Katie, Wadeau to all of you at the Claremore Indian Hospital.
Join the conversation. Discover stories and insights that matter to you. Subscribe to Cherokee411 with Kara and stay connected with independent media, real, relevant, and unfiltered.